CAR T-cell press conference. I'm Dr. Sushila from Apollo Hospitals, and it is my privilege to host today's event. We are proud to announce the introduction of CAR T-cell therapy services across Apollo cancer centers. For decades, the foundation of cancer treatment has been surgery, chemotherapy, radiotherapy, and BMT. While these continue to be critical mainstays of therapy, new categories of treatment have recently helped transform the spectrum of cancer therapy. One such treatment of great value is CAR T-cell therapy. It gives me immense pleasure to announce that we are providing access to indigenous CAR T-cell therapy to our patients across Apollo cancer centers.
Dr. Reddy's pioneering vision to fortify the battle against cancer has not only shaped our mission, but has also ignited a beacon of hope for countless patients across the globe. Under his guidance, the Apollo Cancer Centers have become synonymous with comprehensive care, embodying a holistic approach to patient wellness and recovery. His leadership continues to propel us forward, challenging us to reach new heights in clinical excellence and compassionate care. In keeping with this ethos, our collaboration with domain partners, culminating in the introduction of the groundbreaking CAR T-cell therapy, stands as a testament to this commitment of his. It heralds a new era in the fight against B-cell malignancies and embodying our pledge to deliver the forefront of medical excellence to our partners, rather our patients. The pioneering efforts with CAR T-cell therapy represents not just an advancement in treatment options, but a seismic shift in the oncological care landscape. Apollo Cancer Centers has demonstrated unwavering commitments to advancing CAR T-cell therapy, achieving remarkable success with 3 commercial treatments and 5 clinical trials.
Because today is a very important event for us. Cancer is growing at the rate of 20%. We have done everything possible. We created new cancer hospitals or cancer facilities across the country. But most importantly, our team of doctors, for example, today's the hero for us is Dr. Raja, who has done tremendous amount of work in medical oncology.
If it's working properly, the immune system wants to kill cancer cells. That's its job. Create an army of T cells to patrol our body for signs of infection and other diseases. The T cells inspect suspicious cells and, when they find an abnormal one, immediately lead an attack on it, while limiting the damage to healthy cells. The way they do that is pretty elegant. T cells have protein receptors on their surface, and these claw-like structures latch onto antigens, protein fragments found on the surface of all cells. When a receptor latches onto an abnormal antigen, like one found only on a diseased cell, the T cell turns on and releases toxic chemicals that damage the abnormal cell and recruit other immune helpers to the area. Sometimes cancer cells develop ways to fool the immune system, either by disguising themselves as healthy cells or by sprouting so many antigens on their surface that the T cells are stymied and can't mount an effective attack, or by finding ways to turn off the immune response against them. One innovative way to see through the deception is CAR T-cell therapy. Thousands of a patient's own T cells are collected in a process similar to a blood donation, using a modified and inactive virus that can't cause any disease but can introduce genetic information into a cell. The T cells are reprogrammed so they now produce special receptors called chimeric antigen receptors, or CARs, on their surface. These newly engineered cells, called CAR T cells, are grown in a lab, and millions of them are infused back into the patient. The new receptors enable them to latch onto a specific antigen on the patient's tumor cells and destroy them.
What happens is in cancer, somehow our own immunity is not active for some reason. Cancer is able to easily evade them. But by re-engineering these T cells, we are trying to awaken its immune power and give it back to the patient. And then they will go and specifically act on the cancer cell. That's the whole concept of this. If it is from the patient, it is known as autologous CAR T cell. It can be also from healthy donors, then it is known as allogenic CAR T cells. The beauty of it is that it is, coming together of, very, very exciting technology, engineering and biology coming together. Some call it as some advanced form of immunotherapy, but the scientists really call it as synthetic biology. 12 years ago, this field started, and at that time, this was first done for lymphoma patients with what we call non-Hodgkin's lymphoma cancer. 2010, that's when 2 adult patients were treated with CAR T cells, and it was seen that the cancer cells were gone. Temporarily, they were gone. So they were so amazed, and then that's when this whole field picked up. And this little girl is known as, she is called as Emily Whitehead. She had acute leukemia in the year 2010. And she was treated, but she had multiple relapses. She was in USA, Philadelphia. And in the year 2012, she was the first child to undergo CAR T cell therapy. And these are her own CAR T cells electron micrograph. This is very iconic pictures because, she is one of the very iconic survivor of this treatment. These are her own cells. And these are her subsequent pictures. Now, she is now 11 years post the treatment, and now she's a young, adult lady, and she is completely normal. Such is and she was already at that point when she was put into this clinical trial. It was multiply relapsed leukemia, and it was thought that she won't survive for a few months. That was what. So the revolutionary technology really opened the eyes that something different, a new form of treatment for cancer has arrived. We all know radiation surgery, chemotherapy, and then immunotherapy. This is a new form of cellular therapy has arrived. That's what we all became so excited. Today, the American FDA has approved this treatment for lymphomas and leukemias and for myelomas.
Between 400 to about 450 highly qualified, super technical, amazing clinicians who every day 24/7 battle this disease against cancer. So I think today is a day to say that we're truly blessed. Why are we all here today? Because I think at Apollo we are constantly trying to announce something or call the press and say, listen, we have done it. We don't have to do it, but why do we do it? And we do it because it's not for ourselves. It's not for us to say that, we're Apollo as a company and we're from 1,000 beds today, we're 15,000 beds, or this is our, that is all there, and it's, it's part of the responsibility as an institution. But we call and we talk and we discuss because we want to bring the best in class in terms of treatment to our people. The proton was almost an impossible dream. And it was only because Chairman said that Indians deserve this kind of treatment that we did that in the cancer care. We have about 15 robots which are doing robotic cancers all over the country. Revati and her team have one of the best bone marrow transplant pediatric cancer departments. But more than anything else, Dr. Raja shows his leadership. He heads the complete precision and oncology for the group. And Revati was actually telling me in 2017, July, in one of our messages and exchange, I asked her, because I just traveled abroad and come back, and said, why can't we do CAR T cells? And soon afterwards, I think Dr. Raja has worked diligently on this topic. If we are able to stand here and say, we're doing CAR T cells, we're doing precision oncology, we're doing immunotherapy, it's because he's single-minded focus from him to bring these treatments to India and try and see how can we give it to our patients.
Currently these treatment are done for patients who have already gone through multiple treatments, who have already failed one line, two line, and three line. So they are very difficult patients. That's the beauty of this treatment. And most of these patients are having a very limited lifespan with today's available options. So the CAR T cell, these therapies, what they have done is they have produced a very high response rate of more than 75% in response rates across the world in many clinical trials and in many indications, out of which now nearly 40% of the patients are long-term survivors. In this patient group, they were the expected survival was very, very poor. In that subset, we have shown, the world has shown that